Hello, everyone. Guys. Hello, guys. Can you hear me?
Yes, we can hear you.
Amazing. Okay. Great. How are you doing? Welcome.
Thank you. I'm good. How are you?
Just I'm great. Thank you so much for asking. Just calling the other members, just to make sure that everyone is attending, and after that, I will start the session immediately.
All right.
So we can finish what we need to work on today. Okay, and let me share screen.
Mm.
Okay, so let's just wait for like the first 4 minutes, like 4 more minutes, and then I'm going to start immediately. Until that time, let me just ask you guys, does anyone
Concept.
speaker? Thank you. Okay, so let me just ask you guys, does anyone here has any past or current experiences in the interpretation or medical interpretation or the medical field? Do we have a doctor, a pharmacist here with us? Do we have a former interpreter or even a current interpreter?
Yeah,
Is
mom.
Yeah.
uh, okay. Jonesy, right? Is this how we say your name?
Yes. Correct.
Great. So Jonesy, please go ahead. What is your
Okay.
experience?
I'm nurse by profession, but I have worked on Slingo as interpreter for 1 year.
Oh, okay. So you are a nurse and you already worked in interpretation for 1 year. Amazing. Thank you so much. Who else? Someone else actually tried to say something.
Me.
Yes, dear. Please go ahead.
All
Do
right. Yeah. Yeah. Dash. Oh, yeah. It's
that.
a simple form from Dushimimana. So.
Okay. Dash.
Uh.
Okay. Please go ahead.
Yeah. So also I have a 6 months experience. Yeah. In interpretation, medical field, business, social services, and everything.
Great. Amazing. Okay. Anybody else? What about the others? We still have Kundan, Stevens, Javier. So is this the first time for you guys to hold on, let me call Junior, Junior Rima, Yuri, Diego, Arwa, Abdul. So is this the first time for you guys like applying for such position, working as a medical interpreter? Junior, can you hear me? Junior Rima, can you hear me? Junior Rima, can you hear me? I just added you to the call, so can you hear me? He's having something wrong. Junior Rima, can you hear me? I think I need to remove him and then add him again. Okay, so Diego, who else just joined? Peterson. Oh, I was just calling Peterson. Diego and Stevens, Peterson, Javier. Guys, do you have any past or current experiences in the medical field or the medical interpretation, or this is supposed to be like your first time?
Hello, Norhan. I do have some experience. I worked with Lionbridge about 2 or 3 years ago,
Uh-huh.
and I did some medical interpretation with them.
Amazing. Okay. So, guys, let's start our session today because it's already 12:06. Can you actually see my screen?
Yes, I see
Yes.
it.
Yes, ma'am. Yes.
Great, amazing. So,
All for
before I start talking or like, start the session, let me just very quickly introduce myself to you. My name is Nurhan, and I've been working in this field for like more than 7 years. I worked first as a medical interpreter, medical specialized interpreter, but I was, also getting calls from lots of different places, customer service, banking, social services, whatever, auto insurance and everything, except for court calls. I've been, I was actually doing that over the phone for more than 5 years. I got my first certificate as a professional interpreter after 1 year and a half. And then I got my second certificate as a senior interpreter after another 1 year and a half. And then I got promoted after more than 5 years to like lead a team of interpreters. So I work as a supervisor, and I got promoted for the second time. And now I am a senior supervisor, and also a trainer. So I hope and I guess you are in good hands. So whatever questions you're having, you can just direct your questions to me. And yep, this is very briefly about your trainer today. So those who already worked as interpreters, as over the phone interpreters, I guess that they already have like background information about what we're going to talk about today. So today we'll be talking about the call protocol. Before I start again and talk about the call protocol, I would like to tell you guys that in this kind of job, in this position, we have our own kind of terminology. For the two people that we are going to translate or interpret for and between. So again, I am an interpreter, okay, and this is consecutive interpretation, which means that I will be in between two people having a normal conversation, but those two people are speaking two different languages. The
Mm-hmm.
first speaks English, and the second speaks a totally different language. Whatever, it depends on your language, the language that you are speaking, and the language that you applied to work with. Whether it's Haitian Creole, whether it's French, Spanish, Chinese, whatever. This will be the second language. So the first language is English. The second language is the language that you are speaking, whether it's your mother tongue or a language that you are fluent in. Junior, I'm sorry, can you please mute yourself? And Diego Peterson,
Yes, ma'am.
let me just mute you. Okay. Just to make sure that we're all, hearing each other, or that you all actually can hear me. So again, what I'm going to do is I will be in between two people, or having those two people are having a normal conversation, whether they are like a doctor and a patient, or you know what, mainly you're going to receive medical calls, but it depends on the platform that you will be working on or the company that you will be assigned to, whether you're going to receive some other like different calls in different fields, like what I did, maybe customer service, auto insurance, medical insurance, social services. Like social services meaning that you're going to receive a call from a governmental office, and you're having an employee and a client. So again, it depends on what is the relation that those two people are having together. They're going to translate as the interpreter for those two people. Okay. So this is mainly about what you're going to do and like to give you a brief summary or a brief vision of how the situation would be. So they're going to have you over the phone, which means that they have a device at that office or this clinic or this hospital or this bank or whatever they are. They should have a device or a phone that they are using to get you, and you will be over the phone with them. Sometimes, and again, this depends on the platform and depends on the company that you will be assigned to, whether you're going to receive a video call or not. Again, it depends on the platform. So I cannot guarantee to you right now that you're not going to receive any video calls. This depends on the platform. So you have to have your camera ready as soon as you know that you're supposed to have a camera and you're going to receive video calls. Make sure that your camera is working. Okay, and you are ready at any time to receive a video call. So this is number two, or the second thing that you need to know before we start talking about the call protocol. The third thing is, as I told you, we have our own terminology. No, there is no dress code. Dress code, again, it depends. Well, as far as I know, some companies, they ask to wear a specific, they do have their own dress code. They ask you to please wear black, a polo shirt or a shirt, but not t-shirt, and it has to be black. So yeah, some companies, they also require, or they also have their own kind of dress code. But this is, according to my experience, it's just happening with one company as far as I know. But the other companies, like all of them, they don't have any problem with what you're going to be wearing. Anyway, whatever instructions that you will receive from that company, please make sure that you are applying the instructions, or you are following the instructions. Anyways, number three that I need you to please know before we start talking about the call protocol again and the technicalities or how we're going to do this and that over our calls. We have our own terminology, meaning we don't have a lot of terminologies. I mean, in this job or in this position, we just call those two people different things. Like, for example, I have an English speaking person and I have someone else who doesn't speak English. Okay, and those two people are supposed to be having a conversation together, and you are in between, you're facilitating the conversation. So the person who speaks English, or the English speaking person, is called the client. Okay, and the person who doesn't speak English is called LEP, individual. What is LEP? LEP is short for limited English proficient individual. And why do I call that person limited English? Why didn't I call them like no English, since they don't know the language? Well, sometimes it happens that you're going to receive LEPs, or you're going to have an LEP who actually knows English, because those people, they live in an English speaking country like US, Canada, and UK. They live inside an English speaking community, or with an English speaking community. So some of them, of course, because they are like all the time are dealing with people who are speaking English, and some of them also take courses in the English language to be able to live in an English speaking country. So they have limited knowledge in the English language. Why do we call it limited? Again, because especially with the medical field, they might actually know English very well, but they don't have the medical terminology. They don't know the medical terminologies, and they don't know how to use it, and they don't know the meaning. But you, the interpreter, you have the medical knowledge, and you know the terms, and you know how to use them. Okay? So, and that's why we always, or we call the other party as an LEP, individual, or limited English proficient individual. Still, his knowledge in the English language is limited. Okay, they don't have the terminology in banking, they don't have the terminology in the medical field, they don't have the terminology to use when they go to a governmental office and they when they speak about, or ask about social services and all that stuff. So again, the client is the English-speaking person. The other person is the LEP, Limited English Proficient Individual. Another thing that I want you to be aware of, or to actually know, that the client is the person who's always going to give you a call. The client is the person, the English-speaking person is the person who's going to call to get the interpreter. It's never the LEP. And it's very, very, very rarely when you're going to receive a call and you're only having the LEP on the line, or the LEP who is the person who called the interpreter. It's very rare. It doesn't really happen because it's actually common, and it's very known in those countries like US, Canada, and UK that they are having devices for interpreters, because those are the countries where they're receiving a lot of immigrants, a lot of people coming from different countries all over the world. So they are the ones who are always ready with a device to call an interpreter to help them with the conversation. And another thing is, especially in the US, there is a federal law that obligates, especially healthcare institutions, to get an interpreter for any patient who doesn't speak English. It is an obligation by the federal law. So that's why most of the time, not only most of the time, actually 99% of the time, the person who's going to call you is the client. And that's why, now let's begin. That's why your introduction, as soon as you receive any call, should be in English to the client. So this is my introduction to the client. Again, now let's say that I work on the system. I started my shift and I received the first call. I heard the ringing in my headset and I answered. Excuse me. And I answered the call. I clicked on answer. How am I going to store the call? Again, since you know that the client is the person who's going to give me the call, so I have to introduce myself in English. So my introduction to that person or to the English-speaking person should be, hello, good morning, good afternoon, any greeting that you'd like to start with. If you don't want to think or bother yourself thinking about what time is it there in Canada or US or UK, so that you can say good morning or good afternoon or good evening, if you don't want to bother thinking about that, you can just say hello. Okay, so again, the introduction should be as hello, and then you introduce yourself, you say your name, what language interpreter you are, and then your ID number. Let me give you an example of myself. Hello, this is Nurhan, your Arabic interpreter for today. My ID number is 12345. How may I help you? Your ID number will be given to you by the company that you will be assigned to. And guys, by the way, I am going to send you this PowerPoint presentation after we finish today's session. So there is no need to write down everything. Just take notes of the things that are not included in the sheet. It's gonna help you in the near future. Anyways, again, let's go back to the introduction. Again, my introduction to the client should be, hello, this is blah, blah. You say your name, and then you say what language interpreter you are, and then you say your ID number. This is the general introduction that I should give to all clients. However, there is another part that can be added to the introduction. Okay, so according again to the company or the platform that you will be working on, oh, well, you know what? If they send you any instructions, any further instructions about please add this part to your introduction, just follow the instructions of the company. But this is the general protocol. This is the general one that we have. Some companies add some parts to the introduction to the client, like please speak in complete thoughts and short phrases. Some companies add that part, and some other companies they don't add it, and they just go with this general introduction that all other companies are following. Okay. Now let's move to the next part. I'm sorry, it seems like, hold on, guys. Guys, I'm sorry, can you please keep your questions till the end of the sessions or to the part where I'm going to ask you if you have any questions, because whenever I have like a pop-up of a question or something, it really like this distracts me. Okay, what if an LEP calls the interpreter through the line? If an LEP, okay, so you're asking again about the very, very rare situations at any time. If let's say I receive a call and the LEP individual is the person who is on the line, I can very politely ask them to please give us a call back when the English speaker or the client, you're not gonna say the client, when the English speaking person is on the line. Usually, guys, that happens with like in big institutions, like very big hospitals. Someone would actually call, a patient would call a hospital, and they wanna like maybe schedule an appointment. But they hear on the IVR system, when they like dial the number trying to reach a nurse or someone, they hear for English, press 1. For other languages, please press 2, for example. So they press 2. So the system automatically connects the person to the interpreter without actually reaching the client first or the nurse first or the registration office first. Okay, so that's a mistake. In this case, if you again receive a call with the LEP, advise them to please give us a call back when the English-speaking person is on the line. If they tell you how, ask them to call again and to choose English first, and then ask to get an interpreter over the phone, and that's it. And then say your closing and end the call. I hope that I answered your question, but guys, please keep your questions until the part where we can answer questions. Now, after we did the introduction to the client, there is something else that you really need to know about. It is very important. It is actually crucial. It's not only very important, it is crucial. The intake questions. What are the intake questions? Sometimes, depending again on the platform, okay? Some platforms, they don't have this intake question thing, and some other platforms, they do have it. It depends on the type of contract that the company is having with the institutions in those countries, okay? So sometimes, as soon as you have a call, an incoming call, and as soon as you answer, you have a pop-up screen, a very small screen pops up. Either it is like another screen, or it is already on the screen where you can see the information of this call. So it's a small screen that's going to pop up, okay, in front of you, and it has some questions. We call those questions intake questions. What is the importance of those questions? Those questions, hold on, I'm sorry. So I went mute. Okay. Okay, can you hear me now? Diego?
Yes, Marhan, I can hear you now, but I don't know if that was like an error for all the group or only me.
Okay, so guys, at any time you think that there is something wrong with the audio or something, just let me know immediately. Okay, so let's get back to that part again. intake questions, you're going to, as soon as you answer a call, you're going to have some questions popped up on your screen, and there is a place or a slot, an empty slot for you to answer or to put the answer for those questions. You're going to get the answers of those questions from the client. It is very crucial and it's very important for you to put the correct answers on the screen or on its correct place. And you get the answers again from the client. Why? It is important for billing purposes. What does this mean? This means that if you don't get the answers to those questions, unfortunately, the company will not be able to bill that client for the services that they got through you, the interpreter. The answer to that question or to those questions serves as a proof that that person called and got an interpreter over the phone. So they are going to send the bill to that client, and the client is going to pay for those services that way. If you don't get the answers, we will not be able to bill the client for that call, which means that unfortunately we will not be able to pay you for that call. Since it's a win-win situation, we really need to follow the instructions, especially with that part, so you don't lose the money for that call. Okay, and the company also doesn't lose it. If at any time the client asks you or the client tells you or refuses to give you the answers for any reason whatsoever, if they tell you, interpreter, I apologize, this is the first time to actually use the interpreter, so I don't know and I don't have the answer to those questions. Can we please proceed with the call? If they, for whatever reason, cannot and would not give you the answers to those questions, please don't proceed with the call. Very politely, you can say, I apologize, ma'am or sir. The system will not allow me to proceed with the call without the answers to those questions. Please get the answers to those questions and give us a call back, and we will be more than happy to assist you. Okay, so very politely refuse to proceed with the call, ask them to get the answers and give us a call back. So this is regarding the intake questions. After you get the answers to the questions and everything is like smooth, after that you need to ask or you need to give the client the transitional phrase, which is the patient with you, or how may I help you, or how would you like the interpreter to assist, whatever, the way that you're going to say it. Just go with this transitional phrase to give the client the indication that you are done now with asking the questions, you are done with your introduction, and now you are ready to proceed. So let me give you a quick example on how this part would go on a normal call. Let's say, for example, that I have a call, an incoming call. I clicked on answer, and I have two questions on my screen. The first question is the caller's first and last name, and the second question is the department code, for example. So what I'm going to do, this is what I'm going to do. Hello, this is Norhan, your Arabic interpreter for today. My ID number is 12345. May I please have your first and last name spelled out? So if they give me first and last name spelled out, I say, thank you. May I please have the department code? They give me the department code. I put the department code on the system, and then I say, thank you. How may I help you? Or is the patient with you? How would you like the interpreter to assist today? The way that you're going to say it, it's up to you. However, this is how the first part or the first phase or the first, few minutes of the call should go. If you have questions, that's fine. If you don't have any questions, then you just, after you finish your introduction, you go ahead with the transitional phrase. Now, does anyone have any question about this part? This part, you can raise your hands. No questions. Amazing. So let's move to the next part. After you ask the transitional or you give the transitional phrase to the introduction, they would say, for example, thank you so much, interpreter. I have the patient here with me. Please introduce yourself to the patient, for example. So how am I going to introduce myself to the patient? Of course, as I know, and as you know, the other party or the other person is the LEP. The LEP is the limited English proficient, and they speak a different language. So my introduction makes sense, should be in the other language. What am I going to say in my introduction to the patient or the LEP? First, you need to introduce yourself to that person. You can say your name, and then you say that you are the interpreter. If you don't want to say your name, that's fine, but just say you are the interpreter. Okay, so first do the introduction, and then you're going to say two very important sentences to the LEP. Guys, it's very known that LEPs usually speak a lot. They usually speak a lot because when they find someone who speaks their own language in a country that speaks only English, they feel like home. They feel like you are someone that they know. They feel like they can like feel like they can say whatever they want to say. They can socialize with you. They can even take your phone number and your name and like call you whenever they need an interpreter there to help. It's known that the LEP is someone who actually speaks very much as soon as they find someone who speaks their own language. They feel very comfortable and they like speak a lot. And that's why in my introduction to the LEP, I need to, okay, so first, before I actually like tell you about this sentence, let me explain first the first sentence. So after I say that I am the introduction, first, I need to reassure the LEP individual that don't worry, all of your information will be kept confidential, and don't worry, I will do my job, with transparency, and I'm not gonna leave anything out. I'm not gonna add anything that you didn't say, and I'm not gonna leave anything out from what you said. So I need to tell them I will interpret everything that is said and keep it confidential. And then ask the LEP in order for me to be able to do my job, in order to guarantee accuracy, as you expect, as you want me to do, please speak in complete thoughts and short phrases. And this is the part about the um, uh, you know, asking or telling the LEP to please don't feel comfortable, don't feel like, it's your home, don't feel like I'm someone that you have known for a long time, and keep speaking nonstop, giving me a lot of information, thinking that I will be able to do interpretation with all of that. Of course, it's not going to happen. You're a human being and you're actually taking notes. So we need to be able to take proper notes and to assure accuracy or make sure that we are maintaining accuracy. We are like having complete thoughts and short phrases, or small segments, or like short sentences. Regarding the confidentiality part, the most important thing that I need to say in my introduction to the LEP, and this also can sometimes be added to my introduction, in my introduction to the client, but some companies don't include it. Some other companies include this part because it is very important. If you guys have any like background information about the HEPA rules, HEPA is short for, let me write it down for you guys here. HIPAA. This is health institution, I guess, portability and accountability. Hold on, I'm sorry. HIPAA is health institution. This is a new kind of rule that is uh, it is a federal law. I'm sorry, Health Insurance Portability and Accountability Act, and it was like issued on the 19th, in 1996. So it basically and mainly says that those who work in the in any health institution should actually keep the information, the health and personal information of patients confident, and that they shouldn't speak about their information with anyone, even with family members, without their permission. So this is HIPAA, and you have to be actually HIPAA. Exactly, thank you. You have to be HIPAA certified interpreter to be able to work as a medical interpreter. And I guess, again, the company that you will be working with or assigned to is going to give you a test. First, they're going to give you an orientation session or video to watch and some information that you have to like not memorize, but make sure that you know them by heart. And then they're going to give you a test on that, and after the test, they're going to give you a score, whether you pass or you don't pass. So if you pass, you're going to get your certificate in HIPAA. So you will be a HIPAA certified interpreter. Anyways, this is again takes us back to the confidentiality part. So if you are a HIPAA certified interpreter, you have to say or add this part to your introduction to the client. So you are like informing the client some way that you are a HIPAA certified interpreter. If not, I don't think that this part will be added to your introduction to the client. Anyways, so why do I add again this part to my introduction to the LAP? Because LAPs, again, they live in a place or in a country that doesn't speak their language, that they actually don't know very well exactly as they know their home countries. So they are kind of concerned about whether that interpreter actually will be transparent first in saying everything that I'm saying, whether they are going to do their job as I expect or not. And are they actually going to take my information and use it somewhere? Because sometimes, guys, you're going to have social security numbers. Okay, like those people are going to give social security numbers. They're going to give their health information over the phone to you, the interpreter, so you can translate that. So of course, something like this, it's like a big deal to especially LPs who doesn't know the language and the country very well. So they might have like some concerns. Even without giving them a chance to think about those concerns and consider them, we are already including that part. We're already reassuring them in our introduction that don't worry, we're going to do our job as you expect. I am going to interpret everything that is said, and don't worry about your health and personal information. I will keep it confidential. I'm not gonna speak about it with anyone outside this school. Okay, so this is the first part. Second part, again, since we know and it's well known that again, LPs are the ones who speak a lot, who tend to give a lot of information at the same time. So we are kind of asking them politely to please, if you want me to do my job, please help me do my job. Help me with speaking in complete thoughts and short phrases. So guys, does anyone have any question about my introduction to the LEP, about the sport? Amazing. Okay, let's move to the next part. Now let's say that I did everything right with the introduction to the client. I got the answers to the intake questions. I thanked the client. I went with the transitional phrase, and then I introduced myself to the LEP. After, okay, so actually after I like finished introduction with the LEP, I should go back to the client and again give them another indication that the interpreter now is ready. Okay, so I go back to the client and say interpreter is ready, for example, or interpreter is ready to proceed, or interpreter is ready for your instructions. Whatever the way that you're going to say, But after you introduce yourself again, you need to go back to the client and give them the green light to start. Let's say, for example, the client started, okay, interpreter, please ask the patient what's their first and last name and whatever. And then they went with the cool, they went with their own conversation very smoothly going, and you are going between them from here to there and from there to here and so on and so forth, going back and forth between both of them without having any problems. First, during your renditions or during the interpretation itself, the kind of pronoun that you're going to use, you are, okay, so you are actually matching the speaker's um, uh, register. What does this mean? This means that if the speaker says, I am going to give you a medication to help you with whatever problem you're having. Let's say, for example, I'm going to prescribe a medication that's going to help with your sleeping issues. Okay? So you go to the other person, to the patient, and say, I am going to prescribe you a medication to help you with your sleeping problems. So you are matching the register of the speaker. If they say I, you say I. If they say they, you say they. If they say he, she, it, you go with he, she, it. So you are the voice of that person in a different language. You don't go with, the doctor said that you are going to get a medication to help you with your sleeping problems. We don't do that. Okay? So again, this is the way that I'm doing the interpretation. I am the voice of that person in another language, which means that this is not my conversation. Always put that in your mind. This is not my conversation. That I'm not part of it. And I'm just facilitating their understanding. I'm just facilitating their conversation together. I'm just helping them to understand each other. But this is not my conversation. I'm not part of it. I don't have to talk about myself or refer to myself as in I. Never. So what if maybe someone said something that I didn't hear? What if I need any clarification? Someone said something that doesn't really make sense to me, especially LPs. Maybe the client gave me a piece of information very quickly to the point that I had no chance to actually like take proper notes. So I can't really give an accurate rendition. I might need repetition for. Or maybe they said something that I need verification for. I just want to make sure that I understood the client very, very well, so I don't, like have any misinterpretation. Here, this means that I'm going to intervene, right? Since I said this is not your conversation, interpreter, you are just facilitating it. You are not part of it. If you say anything that's going to like interrupt the conversation, that's going to intervene in their own conversation, there is a protocol for you to actually follow to be able to do that. Excuse me. So if at any time I need repetition for either party, if at any time I need to ask for clarification, repetition, verification, I need to say, excuse me, this is the interpreter speaking. So if you notice something, you're talking or you are referring to yourself as in the interpreter. You are referring to yourself as in or as in third person. You're doing that in third person. You don't say, excuse me, I want you to please repeat. Or can you please repeat for me? No. First person is only used in your interpretation. People are speaking together. They say I. So you are using I. You are using first person in your renditions, in your interpretation. But when you talk on your behalf, when you talk about yourself as the interpreter, you are referring to yourself as in third person. Again, why? Because you're not part of this conversation. You are not part of the conversation. So whenever you talk about yourself, you refer to yourself as in third person, saying the interpreter. Excuse me, this is the interpreter speaking. Can you please repeat the last sentence? Can you please repeat for the interpreter? If you do want to say, excuse me, this is the interpreter. If you want to just do the intervention without saying, excuse me, this is the interpreter, you can just say, can you please repeat for the interpreter? You just have to identify again your speech from either party's speech. Because if you don't do that, you're going to create confusion. If you say, for example, excuse me, can you please repeat? Here, the client would think, well, who's asking for the repetition? Is it the patient or is it the interpreter? I don't know. Anyways, I'm going to repeat. So here again, you are creating confusion even for a second. We don't want that to happen. So again, to avoid any confusion, to make sure that you are transparent and to identify your speech from either party's speech, please say that this is the interpreter, or the interpreter is asking for this, the interpreter is asking for that. Okay, let's read this part. Identifying yourself as the interpreter in third person. And we call it intervention again because this is not our conversation. So we are going to intervene by saying something extra that is not said by either party. Okay? Clients expect that you will be transparent as an interpreter and will clearly identify yourself whenever you speak on your behalf. That means whenever you ask for repetition, clarification, or need to speak on your own behalf as the interpreter for any reason, our clients expect to hear you say, excuse me, this is the interpreter speaking. This practice ensures transparency and clearly identifies any statement from the interpreter as from the LEP. Why? Because, again, you are going to actually use this phrase with the client. At any time you're going to ask for any repetition or clarification, even from the LEP, you should go first to the client and say, excuse me, this is the interpreter. The interpreter needs to ask the patient for a repetition. The interpreter needs to ask the patient to repeat the phone number. The interpreter needs to ask the patient to verify their first and last name. What, for example, just giving examples, okay? So whatever you need to say, whenever you need to intervene for any reason, you go first to the client in English and say, excuse me, this is the interpreter speaking. The interpreter needs 1, 2, 3, 4, 5, whatever you need. And then if it's something that you need it from the LEP, go to the LEP after you tell the client, go to the LEP and say, this is the interpreter. Can you please repeat? Can you please, I'm sorry, clarify? I'm sorry, the interpreter didn't catch the phone number. Can you please repeat it? Any way you're going to say it. However, the intervention, again, should be used with the client first, as if you are getting the permission from the client to speak. Okay? So I am doing that with the client first to get their permission, to tell them why I am intervening, why I am cutting off your conversation with your patient or your whatever, the other person, whatever the relationship that they're having together. Okay? Guys, does anyone have any question about any of the parts that we talked about until now before we move to the next part? You can raise your hands. Thank you, Rama. Amazing. Okay. Excuse me, just drinking a little bit of water just to be able to continue. Okay. In 10 minutes, we're going to take a break, a very brief break. Now let's talk about your responsibility on the queue as the interpreter, or your responsibility on the call. Your main responsibility is to control the flow of the conversation. What does that mean? What is the flow of the conversation? The flow of the conversation is, if you have any normal conversation with someone, what is the flow of the conversation? The flow is you speak, the other person speaks, and then you speak, and then the other person speaks, and then you speak, and then you are going, you know, it goes between you and another person. You speak, he speaks, you speak, and you speak, and so on. Like it goes 1, 2, 1, 2, 1, 2. So this is the flow of the conversation. The flow of the conversation has to be smooth, as if they two are speaking together without having someone in between. Okay, so this is again the flow of the conversation. The flow of the conversation has to be smooth, going between one person and a second person. First person speaks with the second, second replies, first speaks, second replies, first speaks, second, and so on and so forth. Okay, so it should go ton, 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 going back and forth. This is the flow. So my responsibility here is to control this, to control the flow of the conversation, to make sure that those two people are speaking together as if they are having a normal conversation, as if they are speaking the same language, without, feeling your presence as a third party in this call. So the interpreter is responsible for ensuring that all parties in the call have access to the spoken dialogue as if they spoke the same language. This could include, but is not limited to. Number one, if we want to control the flow of the conversation, if we want to make sure that it's a smooth flow, we need to keep our interventions to minimum. Imagine that you have a call between a doctor and a patient, and they keep hearing, excuse me, this is the interpreter speaking. Excuse me, this is the interpreter speaking. I'm sorry, can you please repeat for the interpreter? Can you please do that again for the interpreter? Excuse me, this is the interpreter speaking. If they hear that a lot during their conversation, this means that the flow of the conversation is interrupted. It's not a smooth flow of conversation, right? So again, make sure that you are controlling the flow of the conversation. Keep your interventions to minimum, only if it's necessary. Only if you can really hear them, if you lost them, if someone said something and you completely didn't hear it. Maybe they said something that doesn't really make sense, that you cannot make sense of what they said. So you need to make sure, again, that what you heard is correct, what you understood is correct. Okay, only if it's necessary. So keep your interventions to minimum. And this takes me to another part that I'm going to actually talk about in a bit. But again, I need to connect things so that you can understand better. This takes me to the part that you have, or the skills that you have to work on as the interpreter. You have to polish your note-taking skills. Excuse me. You have to polish your note-taking skills. You have to make sure that you are actively listening to the speaker, which means that you are working in a place that is free of distractions, that you technically are doing okay, your headset is working properly, your PC is working properly, your internet is not interrupted, you have a stable connection, and you're working with the Ethernet cable, your cable is working properly. Make sure that technically you're doing okay, and your skills are polished, your ears are actually taking or getting used to hearing the speaker, not only hearing the words, but hearing and understanding. So make sure that you are an active listener. Practice that. We're going to actually practice that together. But again, make sure that whenever we start doing this practice, it is an important practice for you to polish your skills, or the skills that is needed to work as an interpreter. So we need you to be an active listener. We need you to understand the speaker very well. We need you to make sure that you're not distracted. We need you to also to have the knowledge, the medical knowledge, so that you can translate smoothly without, interrupting the speaker, without asking for repetitions, or without, making them wait for you until you look up, a term or something very quickly. So we need to make sure that we are fast in taking our notes. We are fast in doing our renditions. We technically are doing good, like we don't have any problem with the internet or the headset or the PC or whatsoever. So we can keep our interventions to minimum. Next thing that you can do to control the flow of the conversation is reminding all parties to speak in complete thoughts and short phrases or small sentences or short sentences. If you remember, we already add this part to our introduction to the LEP because it's known that the LEP individual is the person who speaks a lot. Okay? But what if the client is the person who's speaking a lot? Is the person who gives me a lot of information at once? Here, if they are giving very long sentences with a lot of information to the point that you lose them, to the point that you can no longer actually follow their pace and have the proper notes, you can stop them and very politely say, excuse me, this is the interpreter. Can you please give the interpreter shorter segments or workable segments, segments that I can work with, just to maintain accuracy. You can also remind them that you are taking notes. You're not a machine, okay? So you can say, excuse me, this is the interpreter. To maintain accuracy, I'm sorry. Can you please give the interpreter workable segments? The interpreter is taking notes with a very friendly tone of voice and very polite and professional way of speaking with the LEP. With the client. Because again, if you think about it, if one party is speaking a lot and the other party is not actually speaking and can barely speak or respond, this is not a controlled flow of conversation. Someone is taking over the conversation and the other person cannot speak, which is in normal life. If those two people are actually speaking the same language, they could have or they would have had a normal conversation where someone is understanding very well what's being said and they can respond and they can stop the speaker at some point, right? But because they don't understand the other language, so they just wait for the interpreter to start the interpretation, but the other person is like speaking nonstop because the interpreter understands what they are saying, but the other person doesn't understand, and they are, waiting. Okay, so when are you going to stop? I really need to know what you're saying now. Again, this is not a controlled flow of conversation, so make sure that neither party is actually taking over the conversation or speaking a lot without waiting for the other person to know what they are saying. Another example here, but again, this is not limited to what we're saying or the examples that we're giving you. Informing all parties that as the interpreter, you cannot explain, you only interpret. This is very important, guys. First, if at any time, maybe the client didn't understand what the LP said, okay, so let me give you an example. I guess it will be better in understanding this part. For example, you just translated a sentence to the client and client told you, interpreter, you know what? I don't really think that I understand this. Can you please explain what he meant by that? So here, you need to say very politely, you need to tell the client very politely, excuse me, this is the interpreter. The interpreter just interpreted what the patient said. If you need any further explanation, or, okay, you can just say, excuse me, this is the interpreter. The interpreter just interpreted what the patient said. However, if you'd like, the interpreter can ask the patient to explain. Okay? So here you're telling the client in a way that your job is only to interpret. And you are also telling them that you are transparent in what you're doing. You're just translating what the person is saying. And transparency means that you cannot explain. You cannot explain because the best person to explain a speech is the person who said it. Even though we speak the same language, yes, I know this. but I'm sorry, I can't explain. Maybe he means something else than what I understood. If I explain what I understood, it might still be wrong because we never know. The best person to explain is the person who said it, right? So again, if the client asks you to explain, you can very politely say, excuse me, this is the interpreter. The interpreter just interpreted what the patient said. However, if you need any further explanation, the interpreter can ask the patient to explain what was that, or to explain the speech, or whatever, to explain himself. The way that you're going to say. Okay, what if it's happening with the LEP? The LEP is the person who asked me to explain what the doctor said. So he might say, for example, interpreter, I'm sorry, but I didn't really understand what the doctor meant by that. Can you please explain? Or they might say, what? What was that? I didn't really understand. So here, in this case, you should go to the client immediately. You're not actually allowed to have any side conversations or small talks with the LEP. So whenever the LEP addresses you for whatever reason or talks to you directly, please, excuse me, please go back to the client immediately and tell them, excuse me, this is the interpreter speaking. The patient just addressed the interpreter asking for clarification or verification or whatever, explanation. So can you please explain for the patient? Here, you are telling the client that you are transparent in doing your job as an interpreter and you are not overstepping the doctor. It's not my possession actually to explain. Even though I might understand what the doctor said, but it's not my possession. I'm not overstepping the doctor's possession. Okay? So we need to make sure that both parties understand the limits of my job. What are the things that I'm doing? They should understand that, again, that this is their own conversation together. They shouldn't add the interpreter to it or engage the interpreter into the conversation. It's not the interpreter's conversation. It's not the interpreter's job to explain. Add to that you can request that only one person in a room speaks at a time to preserve accuracy. Let's say again that in one conversation I have one client and two LEPs, maybe the doctor and parents or the parents of a patient. The patient is a little kid, for example, and the parents are talking to the doctor. I have two LEPs here, the father and the mother, and they both are actually speaking at the same time. So to make sure that you are controlling the flow of the conversation, again, the flow of the conversation cannot go with two people speaking at the same time and one person listening. If you actually even able to hear them both and understand what they are both are saying, even if they're speaking at the same time, when you do your rendition, when you start your interpretation, you're going to commit a mistake with the interpretation. How? If you tell the doctor, this is the interpreter, the father said that he did blah, 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 and the mother said that she did blah, blah, blah. Where is the mistake here? Can anybody tell me? You can raise your hands. Guys, where is the mistake? If I, the interpreter, go to the client or to the doctor and say, the father said 1, 2, 3, 4, 5, and then I go with the mother said 1, 2, 3, 4, 5. Dash?
You are speaking like in a second hand, like you are doing a reported speech rather than doing interpretation.
Exactly. Thank you so much. So you're not using first person interpretation, you're using third person interpretation, which is not correct. Okay? So that's why I need here in this situation to go to the client first and say, excuse me, this is the interpreter. The interpreter needs to remind the parents to just speak one person at a time to maintain accuracy. Okay? And then you go to the father and mother and say, excuse me, this is the interpreter. Please speak just one person at a time to maintain accuracy. In this case, if the father speaks, you go ahead with the interpretation. And then if the mother after that speaks, you go ahead with the interpretation without having any problems or without committing any mistakes with your interpretation. And either way, again, in all cases, even if you have two people speaking at the same time, again, I'm pretty sure that you will not be able to actually take proper notes and you will be confused and the doctor will be confused. So, anyways, just to make sure that we are maintaining accuracy, we're not committing mistakes with the interpretation itself, and we're not creating any confusion, even if it's not our problem. But again, we are in a position where we can control the flow of the conversation, but we didn't. So it's again our mistake if we leave those two people speaking at the same time without asking them to please just speak one person at a time. Another thing that we can do to control the flow of the conversation, we can request actions to be taken to reduce background noise, like turning off the TV or shut the door to better hear the speaker. Let's say, for example, that the client called me. They told me, interpreter, well, I don't have the patient with me right now, and we need to call the patient over the phone. So you are going to do a dial out. Okay? Excuse me. So you are going to do a dial out. After you get the LAP on the line, you hear a lot of background noise. So it gives you a very hard time understanding what they are saying or what the other person is saying because of the background noise. Okay, so here, you again, you are in a position where you can control the flow of the conversation, or you are actually responsible to control the flow of the conversation because the client doesn't speak the other person's language, so they can't tell them to please shut the door or please move to a quieter place or I can't hear you. They just leave it to you. If as long as they can hear you, they're not gonna say that. So you are the only person who's going to have hard time understanding what the LP is saying or what the person who's having the background is saying, right? So again, without even waiting for the client to say that, because in most cases they don't say that, they just as long as they can hear you, they don't have any problem. Okay, but anyways, you need to control the flow of the conversation. You need to make sure that the client still can hear the patient or the LAP when they are speaking, even if they don't understand, but they still need to hear them. And you also need to hear them very well to understand what they are saying so you don't commit any mistakes with the interpretation. In this case, you should go to the client first and say, excuse me, this is the interpreter speaking. The interpreter needs to ask the patient. Of course, we don't say LP, never. So you can tell them, this is the interpreter speaking. The interpreter needs to ask the patient to please shut the door or move to a quieter place or to turn off the TV, whatever the action that you think if it's taken going to make the situation better. Just tell the client what you're going to say to the LEP first and then go to the LEP and say, excuse me, this is the interpreter. Can you please shut the door? Can you please turn the TV off? Can you please do this and that to maintain accuracy and to make sure that we can hear each other? Whatever the situation is, whatever the action that you think is going to the action that is, if taken, going to make it better, please ask for that action to be taken. What if the client is the person who has the background noise? How am I going to ask the client to reduce the background noise? First, I don't and I can't ask the client to take actions to reduce the background noise. But rather, I can just raise the flag. So let me give you an example. For example, the client is the person who's having a lot of background noise. Okay. First, clients don't call when they are at home. Um, very, very rare cases when they are having like an appointment over the phone, maybe with a patient. Very rarely that it might happen that the client is at home actually, and they are doing a telehealth appointment. But most of the time, clients are calling from offices, from clinics, from a place of work, right? So they can't really control the background noise. They can't do anything about it. And that's why we generalize this kind of rule that we don't ask clients to take actions, okay, to reduce background noise. But we can raise a flag. Since clients get bothered so much and annoyed with the interpreters who ask for a lot of repetitions, we can just raise the flag. And if they can't do anything about the background noise, then we just set their expectation that we might ask for a lot of repetitions. So please don't get annoyed or don't get mad with the interpreter or at the interpreter because the interpreter is asking for a lot of repetitions. Okay, so let me give you an example. For example, I can say, excuse me, this is the interpreter speaking. The interpreter can hear a lot of background noise, sir or madam. And then you stop. You just give them like, a second or two and see how they're going to respond to that. If they don't say anything, if they don't tell you, oh, I apologize, interpreter, I will go and turn off the whatever, or I will go and shut the door. Maybe that makes the situation better. Or, you know what? Hold on a moment, interpreter. I'm going to close the window, for example. Just give them a moment to, tell you something. If they don't say anything, you can just tell them, well, I apologize, but it gives the interpreter a lot of difficulty hearing and understanding. And then you stop. Again, give them a moment to like respond or do something or say something. If they just wait for you and they don't say anything, okay, then you can just say, well, this means that the interpreter might ask for a lot of repetition. So I beg your pardon if the interpreter asks for a lot of repetition. Or the interpreter in this case might ask for repetitions. Don't say a lot. Just say the interpreter might ask for repetition in this case. Okay. So again, excuse me, this is the interpreter. The interpreter hears a lot of background noise or can hear a lot of background noise that makes it difficult for the interpreter to hear and understand. Then wait. If they don't say anything, then continue and say, I beg your pardon. In this case, the interpreter might ask for repetition. Okay, if you just don't want to say I beg your pardon, that's fine. Whatever the way that you're going to say it, just try as much as you can to sound friendly and polite with the client. Whenever you intervene, whenever you interrupt the conversation for any reason like that. According to the protocol, again, to be able to control the flow of the conversation, you can request a repetition. But again, keep your interventions to minimum. Only request a repetition when it's necessary, when it's very important. You can also request explanation or simplification of an utterance or term. If someone says something that doesn't make sense, if someone says something that it's complicated, if they say something not ordered, maybe, because sometimes in our speech, we sometimes like say things that are not ordered, that don't make sense sometimes, but when we repeat ourselves, we say it in a way that does make sense. So if that happens again at any time with the LEP or a client, you can very politely request for an explanation or simplification. If it happens that you receive a call, maybe a call with like banking or a call where the two speakers are speaking about something that you know nothing about, you don't know the rules, you don't know actually what they are saying, and you're kind of confused, you can ask for simplification or explanation, or just to give you a moment, or just take a moment to explain very briefly what is this about. Okay, just to make sure that the interpreter understands the topic that you are talking about, so the interpreter can do accurate renditions. Because sometimes we have English words that mean different things, and to choose the correct meaning to this word, you have to know actually in what topic they are speaking, or they are talking about. Okay. um so those are like examples on how to control the flow of the conversation. Anyways, again, just remember, whenever you're going to intervene or cut off the conversation of those two people, you need to use the intervention protocol. Guys, we can take a quick 10 minutes break and come back, continue the last part that we have here. Okay, just mute yourselves, leave your cameras off, leave and come back in 10 minutes. Thank you, all of you. Hello, everyone. Uh, Let me check and see how many
Hello, ma'am.
people returned. Hello. So, who's back? Uh, Peterson back.
I'm back.
Diego back. Thank you. John say back. Who else? Javier.
Hello, I'm back.
Stevens. Thank you. Stevens back. Judy. Kundan. And Javier. Javier, are you back? Oh,
Yes.
Javier back.
Yes.
Thank you. Kundan. Okay, very well. Let's continue. So now we are going to talk about the rule boundaries. What are your boundaries? What are the things that you shouldn't do as the interpreter? Please don't ask probing questions. Probing questions are like questions with open-ended answers, like how and why and what and those questions. Uh, but I say don't actually ask any questions to either party that is not asked. Okay? Again, this is not your conversation. You are not part of it. Please don't ask questions that are not asked, of course, by either party. Um, and don't answer questions for either party. If you know from the beginning of the call, for example, that the patient has been taking the medication and everything has been great since then, and maybe at the end of the call, the client asks, did you take the medication that I prescribed the other day? Since even though you know the answer to that questions, you shouldn't like jump in and say, excuse me, this is the interpreter. The interpreter knows from the beginning of the call that the patient has been taking the medication as prescribed. No, don't do that. Even if you have the answer to the question, don't answer questions for either party. Just ask the question as it is and get the answer from the patient again or the other party again. If the LEP or if the client at the beginning of the call, the doctor at the beginning of the call said that they are going to prescribe a medication that's going to help for whatever. If the patient asks again, doctor, what about this problem that I'm having? Are you going to prescribe any medication to me? Even if you have the answer to that question, don't answer the question. Go ask the client the question as it is again and get the answer from the client again to that question. Do not respond unless you are directly addressed. Don't assume that either party is actually talking to you. If you remember, we said you are not a part of this conversation. You are just facilitating the conversation between those two people. So why assume that either party is actually talking to you? Unless they directly talk to you. For example, a very common mistake or a very common example on this is the question, what? If either party says what, go ahead and translate this as it is. What? If they tell you, no, 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 interpreter, what did you say? What was that? Can you please repeat? Here, they addressed you, and in this case, you should respond accordingly. If the patient is actually asking you to repeat or addressing you, who did what? Guys, why are you like taking us out? Douche, and we had the Peterson. Don't kick each other out, guys, please. Okay. Please mute yourselves. Dash, thank you. And Peterson. So let's continue. I was saying that again, a very a very common question is what? If the patient is the person who's asking you that question, what? Interpreter, I'm sorry, I'm talking to you. What was that? Can you please repeat? Here you go to the client and say, excuse me, this is the interpreter. The patient just addressed the interpreter asking for a repetition, so the interpreter is going to repeat. Okay? If it's the client who's asking you to repeat, there is no need, of course, to tell the LEP. So you go with the client with the repetition, and that's it. Wait for the provider or patient. Sometimes you're going to receive calls that are started with a nurse, for example. The nurse is preparing the interpreter and the patient for the doctor, and they are asking you to please wait until the doctor comes in or until the provider comes in. So here, while you are waiting on the line with the patient only waiting for the provider or the English speaking person, please make sure that you're not socializing, you're not speaking with the patient, with the patient, I'm sorry, in anything personal. If they ask you, of course, it's not gonna be polite not to answer. So keep your answers to very short and brief answers. If, for example, they tell you, "Oh, interpreter, hi, it's nice to meet you. How are you doing? Are you doing great? Oh, I'm so happy to have you on the line. So, where are you? Where are you now?" They're trying to socialize. Okay, so if they ask you like a question, "Where are you now?" or "Where are you originally from?" Maybe guys, you're having some different countries speaking the same language, but you are speaking with different accents or speaking with different uh, um, dialect. So they're just asking you from which country, from what country you are. So this is how you should answer. Uh, for example, I'm from Egypt. Um, I'm from Haiti. I'm from, Italy, for example. If they tell you, "Oh, hi, but you're not here in the United States, are you sure? I really wanted to meet with you because I have a lot of problems here. I'm facing a lot of problems because of the English language, and I really need an interpreter to stay with me. Would you be able to do that?" For example, no, sir, I apologize, I'm not allowed to. That's it. And then you stop and you mute yourself. Okay, so if you answer that way, they would understand that again, you're not allowed to have a small talk with them or a side conversation with them without the English speaking person. And you know, if you, they might like stop answering, asking questions. In this case, if they find that you are like giving a very brief answer and you're not socializing with them and you're not like opening the way for more questions or to like exchange information about each other and all that stuff, so they might stop. But if they don't stop, if they keep like talking to you and like giving you information and asking you for information and all that stuff, here with the third question they ask you, you should say, "I apologize, sir or madam, but can we start our conversation when the English speaking person is there? Or when the doctor comes in? Or when the nurse comes in?" Whoever the person that you are waiting for, you can just ask them to start the conversation, that we can start the conversation when the other person is present or is there. Okay, and then you stop talking. This is if the patient or the LEP is the person who's trying to socialize with me. What if the client is the person who's trying to socialize with me? Actually, to be honest with you, clients don't do that much unless they have time and like they are having a long call with you, so they have time to actually talk with the interpreter. But most probably, they don't do that, and that's because again, they are tight in time and they have a lot of other people that they need to speak with, and they are like at a time where they're actually working, so they don't have time to do that. This is number one. Number two, what if they have the time, and what if they actually keep asking me questions and they are trying to socialize? It's okay to answer the client. It's very okay. You have to actually be friendly and cheerful with the client. But we have two questions here that are very common with clients that, clients and LPs that they usually ask. Where are you from? And where are you now? Or where are you speaking with me or talking to me now? From where? So number one, where are you originally from? This is okay. You can answer that question. You can just say from which country you are. Okay. If they ask you, interpreter, where are you calling me from? Here they need to know if you are working in the United States, in Canada. You know, Canadians, they don't do that, to be honest with you. Usually happens with clients from the USA. And sometimes UKians, like, they don't do that again. They don't have time. Clients from UK, they don't have time for anything. They are always busy. Anyways, so whenever a client, wherever they are, especially in the US, they ask you, where are you calling from? So you can tell them, I am calling from one of the offices that we have all over the world. Don't ever tell them that you are working remotely or you're working from home. We don't say that. We say we are working from one of the offices that we have all over the world. Okay? That's it. This is regarding the most commonly asked questions, especially from the clients from the US. If they ask you that, just answer this. If they ask you any other question, that's fine. You can just reply. But try as much as you can not to give any personal information. Personal information are not allowed. Don't share your phone numbers with clients. Don't share your Facebook ID maybe or Instagram or whatever. We never do that, guys. It's like an immediate termination if you do that. Okay? So not personal information and not saying, of course, that we are working from home. Stay in your role. You are the interpreter. This is your job. Your job is to interpret. If you don't have a client, if you don't have an LP on the line, there is no way or there is no need for you to stay on the line. Okay? Remember, you're not part of the conversation. You are facilitating it. If the patient doesn't answer when you render a message from the provider, just wait for the provider to give you further instructions. For example, if the client asks a question and you didn't get an answer or you didn't actually hear the LP answering that question whatsoever, didn't hear anything coming from the LP's side, don't say anything. Just wait for the client to tell you, interpreter, what was that? Or interpreter, what was the answer? Or interpreter, it seems like the patient didn't hear you. Can you please repeat your question? And so on and so forth. Again, if you don't hear the answer from the LP's side, just wait for the provider's instructions or the client's instructions. Now let's move to the next part, which is professionalism, enunciation, volume, and then we're going to talk about the closing. We're going to give you some more information and some more things that you need to notate. You need to make sure that you are applying while you are doing the renditions or while you are working as the interpreter. First, professionalism. Clients expect excellent, polite customer service-oriented attitude, exactly as customer service agents. If you call a customer service, customer service for any company, whatever that company is, if you call the customer service, don't you actually expect that the person who's going to help you or to get on the line to help you is a polite person and has a positive attitude and is actually applying the training in customer service that they got and the soft skills on you in the call? You expect that, right? You never expect that you're going to have a customer service agent who is impolite or is talking with a negative attitude or is actually like talking in a way, in a strict way, or shouting to you or not respecting you. You never expect that, and it usually never happens, right? It is the same way. Since you are giving services over the phone, you have to adopt the customer service kind of oriented attitude. This has to be your attitude again over the phone with our clients. But the difference is, of course, you're not a customer service agent. You are an interpreter. You are giving language service over the phone. Okay, so please adopt the customer service oriented attitude in your calls with clients, like offering further assistance, being polite, talking with professionalism, using ma'am and sir and madam. You know, use all the things or the soft skills that you might know about from any like past customer service or call center experience. Even if you don't have that, you can just read about the soft skills and the customer service kind of attitude and try to adopt that in your code. Clients expect the interpreter to have a noise-free work environment. Guys, we talked already about the background noise that could come from the client's end or the patient's end that makes it difficult for you to understand either party. What if, imagine that the background noise comes from the interpreter's end? Oh my God. We can't really imagine that. So please make sure that the place that you will be working from at home is a noise-free kind of, work place. It should be a private room, closed doors, closed windows, um, free from any distraction. You shouldn't have like any pets playing around you, dogs barking, or cats meowing. Make sure that you don't have any kids playing around you. Make sure that there is nothing that can be heard from your end as a background noise. TV or even ACs and fans, they sometimes make noise that is annoying, actually, that it sounds really annoying to the person who hears it over the phone. This is number one. Number two, make sure again that you have a headset with a noise cancellation feature, like it has a feature in the mic to cancel any background noise. Okay. Clients expect the interpreter to start calls immediately with no noise when you adjust the microphone and no volume changes and etc. Again, make sure before you start your shift that you adjust the mic, you adjust your volume and the volume of your headset. Make sure that you do everything technically before you start your shift. Make sure that everything is ready for a smooth working day. Okay? And the most important thing here is to start your calls immediately, to answer your calls immediately. You have maximum 5 seconds to start your calls. This is the protocol, maximum. So you should answer your calls in 5 seconds or less. Imagine you have a 911 call. A 911 is the emergency line, right? They shouldn't wait for you. They never should wait for the interpreter. As soon as they click on the button to connect to an interpreter, they have to be connected to an interpreter immediately at the same second. So please make sure that you don't leave your PC unattended for any reason. So at any time you are receiving a call, you answer the call immediately. Enunciation and volume. Clients expect interpreters to speak clearly and at an appropriate volume. If you know about yourself that you are someone who speaks in a way that is not clear in your daily life, you know about yourself that if you hear it a lot from people around you, that they don't understand you, that they always ask you to repeat yourself, that they tell you, please raise your voice, we can't really hear you. Please work on this issue because audio issues are a lot. And we don't want to add to it that the interpreter is not clear or the interpreter speaks with, a very low volume or the interpreter is very quiet. We don't want to add to that the interpreter is having a problem. Okay? Clients expect excellent, polite, friendly tone of voice. Of course, needless to say that whenever you're going to talk to a client or an LEP, you have to speak with a friendly, cheerful, and polite tone of voice. Clients expect the interpreter to mimic tones and voices of both parties. This is a little bit tricky because not all people can do that. However, try as much as you can to mimic the tone of voice because tones of voice, your tone of voice is a way to send a message. It is one of the ways to send a message, right? So if someone wants to tell the other person that I am mad at you, it shows in their voice. If they want to say that we are sad, it shows in their voice. If they want to send a message that they are very happy and oh my god, everything is amazing and I'm so glad today for whatever reason, it shows in their voice, right? So if you have two people and you have someone who is angry and shouting and they are, they really are mad, show it in your tone of voice, but don't overdo it. Don't overdo the negative feelings. If they are shouting, you shouldn't shout, of course, under any circumstance. You shouldn't shout. But you kind of can show in your voice, in your tone of voice, that the person is mad. Or this person is not believing what's happening. So, oh my God, I'm in like, I don't know. Uh, I'm amazed. Show it in your voice, in your tone of voice. If someone is sad, trying, the doctor maybe is giving bad news to the patient and they're trying to sympathize and empathize with the patient and trying to show it in their tone voice, try to show it in your tone of voice when you translate their segments. Because again, it's not convenient if you have someone who's sad and trying to empathize with someone and they are showing it in their tone of voice, but you are doing the translation in a cheerful tone of voice for them. It's not convenient, right? It doesn't make sense and it's not convenient. So try as much as you can to show again the feelings that they are conveying in their tone of voice, in your tone of voice when you do their renditions. Now let's get to the closing. I'm trying as much as I can to like speak faster and give you the information all at once because we're running out of time. So I want you guys to please make sure that you are focusing and I have your full attention here. Now let's talk about the closing. What if everything actually went very smooth? Rama, I'm sorry. Hold on, let me guys. Oh, thank you. It's Rima actually. Okay. So let's get back to that. So what if everything went very smooth on the call? I was going back and forth with the client and the LP, and whenever I needed to intervene, I was using the intervention protocol, and everything was amazing until the end of the call. Then the client, like they said, for example, interpreter, you've been a great help today. Thank you so much. That's it. So they are ending the call, right? So here I have two scenarios. The first scenario is when the client indicates the end of the call and they are still there. They are still connected to my call and they are still there. They didn't still ended the call yet. In this scenario, I need to offer further assistance before I end or before I close the call or before I say my closing. What is or how am I going to do that? If they tell me, interpreter, that's it, thank you so much, then I should say, this is the interpreter, will that be all? Can the interpreter help with anything else? Would you like the interpreter to further assist with anything else? Whatever the way that you're going to do it, however, you need to offer further assistance before they confirm the end of the call. So you say your closing. What is my closing? Your closing should be, thank you for using our services in the other language first, to the LEP first, and then you say, thank you for using our services, interpreter disconnecting in English. Why do I have to say thank you for using our services to the LEP first? Again, the LEP doesn't know English. We assume, again, that the LEP doesn't know English very well, so they don't know if the client is ending the call with me or not. So when I say the closing to the LEP first, here I'm telling them in a way that this is the end of the call. You want to say anything else, please say it very quickly because we are ending the call. The interpreter is leaving. Okay? And after you say thank you for using our services to the LEP, just wait for a moment or 2 seconds or whatever, and then say thank you for using our services, interpreter disconnecting in English. Just trying to give a chance for the LEP to like either thank you or to say something else to the client. Okay, so this is the first scenario, and I still have everybody on the line. What if the client thanked me and they ended the call? They hung up on me. I still need to say the closing. Thank you for using our services. Thank you for using our services. Why? For two reasons. The first reason, for quality purposes. If someone is actually, if someone from the quality team is monitoring your call, they would like to hear you say the closing as it is. This is number one. Number two, sometimes the client's devices are not working very well, are kind of old, so they think that they ended the call, but the call is still is connected. So whenever they hear you say the closing, they would realize, oh, okay, we didn't end the call, so we're going to go to the device and end the call properly. Okay. Do you have any question, guys, about whatever that we talked about until now? Does anyone have any question whatsoever before we like say the last thing? Okay, amazing. Kundan, what is your question?
Hi, ma'am. Actually, what I wanted to ask is, uh, just like you explained it before, but still I didn't get it properly. The question is that when the LEP is speaking more than one person, at that point of time, what am I supposed to say so that things are on the clear for me?
If you have more than one LEP and those two LEPs or three LEPs are speaking at the same time. Is that your question? You want me
Yes.
to like repeat this part? Okay. So if I have more than one LEP in the conversation and those two LEPs are speaking at the same time. Let's say, for example, I have a father and a mother, and they are speaking to the doctor at the same time, trying to explain to the doctor, for example, what happened to their son last night. And, they're both are trying to explain it in their own ways at the same time. At the same time. When people are speaking over each other. So this is what's happening. The father and the mother both are speaking at the same time and trying to explain to the doctor what's happening or what's the situation. So in this case, you need to stop them. Go to the client and say, excuse me, this is the interpreter, or wait until they finish. And then go to the client, say, excuse me, this is the interpreter. The interpreter needs to remind the parents that one person should speak at a time. One person should speak at a time to maintain accuracy. And then, after you say to the client this sentence, you go to the two LEPs who are speaking at the same time and tell them, excuse me, this is the interpreter. I apologize. Can you please just speak one person at a time to maintain accuracy? They're going to tell you, yes, of course, interpreter, we apologize, I'm sorry. Then you can ask, okay, so can you please repeat what you said? So they are going to repeat what they said, one person at a time. Okay?
So that's very basic, I understood. It's just that I have to mention to the doctor, I mean the client
Exactly.
also, that two people are speaking at the same time, so I have to talk to them. Thank you, thank
Yes,
you, thank you.
exactly. You need to tell the client what you're going to say to the LEPs in the other language. The client needs to understand, the client needs to know what you guys are speaking together about, because he doesn't know the other language. So if you go to the patient or if you go to the LEP directly, talk to them without telling the client what's happening, the client would think here that, am I left out? Why didn't he tell me, or I don't know what they are speaking. They might actually tell you, interpreter,
Right.
what did you say? Or what are you guys talking about? Okay? So again,
Right.
we need to
Yes.
keep the client in the loop. Guys, please write down this phrase, keeping the client in the loop all the time. This is again one of the most important things that you should follow in the protocol. Keeping the client in the loop all the time. Whatever happens between you and the patient or the LEP, you have to tell the client about it. You have to tell them even very briefly. Very briefly. The interpreter was asking for repetition. The interpreter asked for repetition. The interpreter asked for clarification. The interpreter said 1, 2, 3, whatever, very briefly, but you need to tell the client what was happening between you and the LEP. They have to be kept in the loop. Okay, any other questions, guys?
Actually, I do have another question, ma'am. May I go forward with it?
Sure. Go ahead, please.
In this, can you please scroll up a bit? The closing part.
Closing. Okay.
Yeah. It's there. So interpreter, after the client has said that's it, and suppose the client hangs up right away, I have to
Mhm.
mention this is the interpreter. Will that be all?
No, of course not, because they hung up on you.
Yeah. So once I'm mentioning thank you, sorry. Thank you for using our services in other languages, and thank you for using our services. Interpreter disconnecting in English. So
Yes,
can you please tell me this? I'm a little bit
exactly.
confused about that.
Yep. Okay, so it makes sense. In the first situation, when you still have the patient and the doctor in the line, it makes sense that since they are still there, that you can ask for or ask them or to offer further assistance. If they are not there, then who are going to like respond to your offer? No one, right? So since they already
Right.
are not there, then you're going to just say the closing as it is. Thank you for using our services. Thank you for using our service. That's it. Okay. Any other questions, guys, before we move to the last part?
Yeah, ma'am. You in the before Blake, you mentioned about intake forms. So I would like to ask regarding the emergence scores. You said that they be lashing a life whistle because they are emergent calls 911. So what do you do in that situation? Do you do the intake stuff, or
You're
you
gonna
just go
receive
with the flow?
you should not receive any intake questions with 911 calls. However, if it happens and you have a pop-up screen or questions, intake questions with 911 call, you should get the information at the end of the call. At the end, when they finish the conversation, when the situation is resolved. And I don't think that you're going to receive any intake questions for 911. But even if that happens, if that's like a new update or something that I don't know about, just ask your questions in the end of the call.
Right.
Okay? Great. So any other questions, guys? Okay, amazing. Thank you. So this is the last part. This is the last thing that we're going to talk about the protocol. First, we need to give you more of reminders here that you should match the grammar and syntax. The grammar is the grammar. If, for example, the speaker is using the past tense in a sentence, you should use the past tense in your rendition. If they are using the present, you should use the present. So what you shouldn't do here is, if they are using the past tense, you use the present, because you are changing the meaning. Change in grammar or change in tenses changes the meaning of the sentence. Let me give you an example. A sentence like, how many sexual partners have you had? What tense is this? What is the tense of this sentence? How many sexual partners have you had? Guys,
Past.
this is the past. Amazing. Thank you so much. So if you go to the patient and say, how many sexual partners do you have? And you here use the present instead, you changed the meaning. The first sentence, the sentence of the speaker, the sentence where he used the past, here he means, I'm just assuming, I'm just saying that maybe in the past you had, many sexual partners, but this doesn't mean that you saw them all together. Maybe in different times or timeline. I'm not sure. I'm just saying, how many sexual partners have you had? I'm not assuming that you're still seeing a lot of people at the same time in the present. Maybe in the past you saw some people not at the same time, right? But when you say, how many sexual partners do you have? When I use the present tense here, I'm saying that you are actually seeing a lot of people at the same time, right? So I'm telling the patient that the doctor is assuming that you are kind of this kind of person who meets a lot of people at the same time, right? In the present, still, you are seeing a lot of people at the same time until now. Okay, so this is one mistake. I changed the meaning when I changed the tense. Syntax. What is syntax? Syntax, if any of you guys studied linguistics, this is a branch of linguistics that is concerned with the meaning of the sentence. This basically means that you have also you have to match the meaning of the sentence. The other part of this sentence, of the sentence that the speaker did, how many sexual partners have you had? The sentence that you are describing might be HIV. The symptoms you are describing might be HIV. If you go to the patient and say, the symptoms you are describing are HIV, here I changed the meaning. Here I didn't convey the same meaning. Why? Because the speaker actually used might, which means I'm not sure. I'm just guessing. I need to investigate this more. This is not a diagnosis yet. But if you go and say, the symptoms you are describing are HIV, here you are definite about it. You are conveying a meaning of definitely. I am definite. This is HIV. You have HIV. This is a diagnosis. Okay? So again, make sure that you are maintaining accuracy, that you are, again, make sure that you are conveying or you are matching the same tense of the sentence and the same meaning, the same way they are asking or they are using. Okay? Tone and register. We talked about matching the tone before. It's tricky, but try to practice on it. Try to do it. And the register, you have to match the register of the speaker. We also talked about it when the speaker uses the first person or the second person or the third person. If they are using whatever, you are using the same way. If they say I, you say I. If they say I went to whatever, you go with I went to whatever. Okay? Don't say he said he went to whatever. We don't do that. Speech. Make sure to enunciate and speak clearly. We also talked about it. Render the interpretation smoothly, avoiding instances of choppiness. Choppiness here means that you are breaking up. Make sure that you're not breaking up. Okay? Make sure that, again, technically you're doing okay. Your internet is working very well. Your cable is working very well. There is no problem with your cable. There is no problem with your headset or mic or whatever that could cause any choppiness. Now we're going to talk about the call performance, your interpretation skills. Clients expect a complete, accurate rendition of the message that is clear and concise from source to target. This means that I, as the interpreter, shouldn't, where is it? Oh, here it is. Hold on. That I, as the interpreter over the phone, shouldn't make any of those mistakes. That I shouldn't add or omit or do any misinterpretation. What is additions? Additions actually basically meaning that you include extra concepts or phrases that are not present in the original utterance. That you add any words, phrases, or meanings to a sentence that wasn't said. Starting from the words that we say at the beginning of our speech. If you are someone who used to say a lot before you start speaking, this is considered as an addition. If you say okay, if you are used to saying okay or right before you start speaking, and this actually happens with interpreters. So don't think that I'm talking about something that doesn't make sense or doesn't happen. It actually happens. So this is, again, considered as an addition. Please make sure that you are not doing that. Starting from this, you're not adding any new words or phrases or concepts that are not said. Omissions is the total opposite of additions. Don't leave out any concepts or phrases or words that were said by the speaker that are not in your rendition. The magical phrase that I always use in this case is stick to the original utterance. Please add it to your notes. Stick to the original utterance. If you make sure that you are sticking to the original utterance, you are not going to make any mistakes of what we're talking about. Additions or omissions or even misinterpretation or the other problems that we're going to talk about here. Okay? So regarding misinterpretation, misinterpretation means that you are misinterpreting something. You are changing the meaning of something, right? And this happens because either you don't hear very well or you don't understand. I don't hear, so I just say whatever. I did misinterpretation. I don't understand, so I just say whatever. To be able to avoid those two, I'm sorry, I'm just receiving a message from my manager. Let me continue this part and just reply. So if you want to avoid those two problems that could lead to any misinterpretation, again, to avoid any problem or any misinterpretation that might happen because of not hearing well, you need to practice active listening. Make sure that you not only hear the speaker, but you also understand. This is active listening. So any active listeners hears and understands. Practice this. This comes with practicing. So do it a lot at home. You can just play any video on YouTube that is English speaking video. Make sure that you focus very well on on what the speaker is saying. And if you have any captions, play the captions on the second time. So the first time you just hear it without any captions. The second time you can turn captions on and make sure that what you heard is correct. And also while you are hearing, you can take notes. Okay? So this is practicing active listening. To be able to avoid doing any misinterpretation because of a problem with understanding, especially with the medical calls, make sure that you have the medical knowledge through memorizing the medical terms and acronyms that we are going to give you, that I'm going to actually send you after we end the session. Make sure that you have the medical knowledge so you don't have any problem understanding a doctor or having any problem with a medical term, or someone tells you that I have this problem or I have this disease that you don't know the English word for it or even the target in the other language for it. Okay? And you also can use the protocol. The protocol is giving you a permission to ask for repetitions, clarifications, verification, whatever. But try as much as you can not to rely on this, because relying on asking for repetitions and clarifications is not gonna make an excellent interpreter. It's actually going to make you an interpreter who relies on repetitions, who's not polishing the important skills that you need as an interpreter. So you're not gonna continue in this until the end. You're not gonna succeed, to be honest with you. Okay? So don't rely on this. Just leave it to the urgent situation when it's really needed. This is regarding misinterpretation. Redundancy and repetitions, very quickly. Interpreters should not unnecessarily repeat words or phrases in an attempt to clarify the original utterance. Basically, don't say the same thing twice if it's only said once by the original speaker. On the other hand, if the original speaker repeats themselves 3 times, for example, please interpret those 3 utterances. So again, you are not allowed to repeat something that was said once. You're not allowed to say it twice. If it's said twice, you should say it twice. Don't say it once. Okay? Again, you're not allowed to repeat yourself unless the speech is repeated. Again, the magical phrase is What? Stick to the original utterance. The last thing is embellishment. This is very important, guys, because it's a common mistake. It happens with all interpreters, and you're going to actually see it as soon as we start practicing. Do not add words to downplay or emphasize the degree or severity of the message. A very common example is with the word very. Okay? The word very. If the speaker, whatever the speaker is, if it's the patient or the doctor, if they use the word very or any word that emphasizes the severity of the message, you have to have it in your rendition. Don't omit it, because here you are playing with the severity of the message. You either downplay it or you emphasize it. I'm sorry, I have to really reply to her. Okay, so again, especially or not especially, the word very is one of the most common examples. If the doctor said that the patient has a small tumor, the interpreter should not the interpreter should not downplay it and say it is a very small tumor, and so on and so forth, and vice versa. Like, you don't either omit it or add it unless it is present or not present in the original utterance. Guys, it was a pleasure actually meeting all of you today, and thank you so much for staying until the end of the session. Let me just take the attendance very quickly. Okay, amazing. Okay, so this is the end of today's session. To be honest with you, I'm not sure if we're going to meet tomorrow, if I have something very urgent to do at the same time. So I might cancel tomorrow's session, and we might need to see each other again on Monday. So you will hear from me very soon that either we have a session tomorrow or if it's gonna be on Monday. Either way, it is at the same time, 12 p.m. EST. Next session will be talking about medical terms and acronyms and how to analyze a medical term. And we're going to also talk about note taking and the methods that we can use to be able to take proper notes. And we're going to practice. So the next session will be like, we'll have a lot of fun and we're going to practice a lot. We're going to make things a little bit interesting for you guys. So until we meet next time, I'm going to send you this PowerPoint presentation. Please review the protocol again, all of it, and all the scripts that you need to memorize, like the parts that are highlighted in yellow. Those are scripts. So please make sure that you are memorizing those. And the medical terms and acronyms, please work on memorizing those at least 20, the first 20. Okay, so I might ask you next session about the first 20 medical term and 15 or 10. Let's make it 20 medical terms and 10 acronyms. I'm going to ask you about those and the protocol next time. Okay, see you next time at 12 p.m. EST, and I'm going to confirm whether we have a session tomorrow or not, or if it's gonna be on Monday. Okay, thank you all of you. See you next time and have a lovely day. Bye bye.